So we're here trying to take a slightly different approach with talking about concepts and communicating our ideas. One of the things I've talked about in the past with palpation is the idea that accuracy is not your number one priority, or motion is, right? So you don't have to worry as much about being on an absolute specific structure, because many of them are very difficult to appropriately identify. One of the things I want to do here is bring forth some information as to why I will say that, as to what supports my position in that sense. There's a lot of people in a lot of hands-on professions that have been trained, right? Whether or not they necessarily believe this, they've been trained to believe that they can identify very, very specific structures, including very specific soft tissue structures. There's some that you probably can, and there's some that you probably can't. In a lot of circumstances, people would think that L5, being the lowest lumbar vertebrae, would be fairly easy to palpate and identify. It shouldn't be that hard because it's the first bump above the sacrum. That being said, in my personal experience, I would say it's a lot harder than you think it is. One reason it's harder than you think it is simply on account of the fact that you don't know without an image if somebody has 4, 5, or 6 lumbar vertebrae. Odds would be that people would have 5 lumbar vertebrae. There's not all that many people that have 4 or 6, but you're not 100% sure. So you're working on odds, not on accuracy. Even if somebody has 4 or 6 lumbar vertebrae, it doesn't change your aim. Your aim is to identify whether or not there's motion loss and then return it if possible. Now, if we look at research that's actually been produced in the osteopathic realm, one of the things here, it won't show up perfectly on the screen. Some of this is a lighting challenge, some of this is just a challenge of, the ability to zoom in and the size of my lens, but we're going to ignore that to the best of our ability, just so that we have some way to try to work this and give you the idea. I'm going to make sure that you know the title of any research that I'm showing you. So here what we're looking at is palpatory accuracy of lumbar spinous processes using multiple bony landmarks, and this is from 2011. Dr. Karen T. Snyder, Dr. Eric Snyder, Dr. Brian Dagenhart, and Jane C. Johnson, who I believe is a research assistant at the Kirksville College of Osteopathic Medicine, or A.T. Still University, however you want to term it. But what they were looking for is how accurate are people when they're looking for lumbar spinous processes. Right, so we have accurate localization of vertebral segments. This is the abstract. I'm going to read the abstract out. You can find this, and I will put a link to this if I can. And it's not cooperating with me the way that I want. That's fine. But what we're looking at here, accurate localization of vertebral segments is crucial for many treatment procedures. The objective of this study was to determine the accuracy of identification of lumbar spinous process levels by palpation. 3 examiners independently identified the spinous processes of L1 to L4 on 60 prone volunteers using multiple bony landmarks, including the sacral base. So what they're telling you, they had 3 examiners, or 3 people checking, 60 volunteers in prone. They used multiple landmarks, including the sacral base. L5, Tuffer's line, T12, and the 12th rib. So using all of those multiple landmarks, you're likely to be more accurate in what you're doing. There's more pieces of information for you to work with. So that comes into when I have said in the past, move from the known to the unknown. Use as many known pieces of anatomy that you're able to identify something else. So move from the known to the unknown. Such as if I suggest to you that to find the greater trochanter, you don't have to find it first. You should be in the region, right? Broad contact for multi-point discrimination. So if you use a broad hand in the region where you think the trochanter should be, you're probably in the right area, and then what you do is you create motion, and the motion will make the trochanter more apparent. So move from the known to the unknown comes from this, using multiple landmarks to identify. Spinous processes were marked with radio-opaque skin markers. Location of marker placement and presence of anatomical anomalies were determined by posterior, anterior, so posterior to anterior, lumbar radiographs, accuracy of marker placement, and inter-observer reliability were assessed using weighted K values or CAP values, generalized linear mixed models, and Cochrane. These are statistical things we don't need to worry about so much for our purposes here. Correct identification of vertebral level occurred 69% of the time in 69% of the time, so that's the average. 69% of the time, 3 people were able to accurately identify appropriate vertebral levels. So they were saying, go find L3. 69% of the time, they were able to find it. That's the average. Faculty examiners were significantly more accurate in identifying the correct vertebral level than the resident examiner. So it seems like there was 2 faculty examiners and 1 resident. Presence of 12th rib anomalies decreased accuracy for all examiners. So if you have a patient who has 13 ribs, so they have a rib on L1, that immediately throws off your ability to be accurate. If you don't know because you don't have an image and somebody does have 12 ribs, you've got a bit of trouble. Right, so this is in this study. This is 3 people being examined on their accuracy. If you projected this out, or if you had a larger study, the results may or may not be different. They may be better, they may be worse. It depends on the situation, but that's not necessarily what was tested. We want to take this as an indicator, not gospel. Right? The presence of 12th rib anomalies decreased accuracy for all examiners, reducing accuracy from 74 to 55%. So if somebody has a 13th rib or an anomaly with their 12th rib, maybe their 12th rib is fairly short, maybe it's much more like a transverse process, that can also throw you off. Accuracy was higher in male participants than female participants. So it seems as though what they're suggesting is it was easier to identify the appropriate level in the males that were there. That's not indicative of it's easier to find vertebral levels or spinous processes on males than on females. That's indicative of the cohort that they had, the people they were studying. It seems as though it was easier to identify those levels in the males that were there as opposed to the females that were there. This may not be true in other situations. There may be differences that are not accounted for between the participants here. The obesity significantly decreased accuracy at L3 and L4. So obesity, because what you're going to have is greater adiposity in the back, in and around these spinous processes, you're going to have a harder time finding it. When there is more fat, it's harder to find. When there's more tissue obscuring things, it's harder to find. The identification of lumbar spinous processes using multiple landmarks was more accurate than previously reported values. However, accuracy was dependent on examiner experience, presence of anatomical anomalies, and participant characteristics. What we have overall is a top level, or not necessarily a top level, but the average accuracy being 69% in identifying appropriate spinous processes at appropriate levels, being asked to do it, accurately doing it, and then being tested on it. If we have an average, and it's only 3 people here, so we don't want to make a claim that this is absolute gospel, as I suggested before, but what we have is some difficulty here. We have difficulty with being accurate for multiple reasons that are very normal. It is very normal for people to have different anatomy. It's very normal for people to have varying levels of subcutaneous fat. It's very normal for people to have varying levels of muscle. These are normal things that give us trouble in being accurate. Again, this is why I would suggest accuracy is not the most important thing in palpation. Motion is your ability to identify. Motion is more important than your ability to identify an absolute specific piece of anatomy. Now, what I want to do is show a photograph to give us an idea of why some of this might be happening. Now, this won't work out perfectly, but essentially what I have is I have a picture. So we've got 2 different cuts. We've got essentially a cut straight, basically cutting somebody in half top to bottom and cutting somebody in half left to right. What we're going to see here, if you can see where my finger is, and it won't work out perfectly, but we've got L5 and we've got some distance between the spinous process of L5 and the back of the body. Now, if you simply looked at a cut where you've basically got somebody cut in half left to right, you can see, or you can infer, that there's going to be problems finding a spinous process, because the external surface of the body is over here, and then you've got a distance to move towards getting to that spinous process. Now, that is an easy inference to make, and if somebody was going to be somewhat dishonest with you, they could make the case and say, well, that's why you can't find it, because you look at the distance from the surface of the body to the projection of the spinous process and you're going to have a problem. Now, that is somewhat disingenuous, because if we look at the other cut, and again, I understand that this isn't going to show up as clearly as I hope it will, but I may be able to manipulate this a little bit. There we go. And hopefully this shows up a little bit better. The end right here is the end of L5. If we go to here, so if we watch from here to basically where the red arrow ends, and again, I know that this won't show up perfectly, but it's an attempt. We've got the spinous process and then the external surface of the body, right? The kind of gray line, and then you may see a green dotted line. The green dotted line looks like it shows up okay, but what we have is a distance between the spinous process. We've got muscles and we've got subcutaneous tissue. There is a distance. Understanding that basically because of the erector mass towards the spinous process, you get a dip, you get a bit of a valley. That valley is where things should become more apparent, because there's less tissue between one thing and the other, or between the bony tissue, or the border of the bone and the external surface of the body. But there is still distance in a lot of people. It is not as close to the surface as we would hope. It is fairly far away in a lot of circumstances. So there are a lot of very normal reasons, as what I spoke about with respect to the research that we presented here, the specific paper we presented. Again, if you look at other papers, you may find slightly different things, but on the whole, palpatory accuracy is a problem, even in areas where you would think it shouldn't be as much of a problem, such as the lumbar column, where bones tend to be more apparent. But it is noted that differences in people's body makeup, people's body composition, will obscure things. My personal experience with identifying L5 specifically, because of the lordotic nature of the back, because people are back bent, and because there are varying levels of tissue or varying compositions of tissue, it is much harder to find than you think. On very lean people, very muscular people, I often find L5 pretty obscure. Kind of a personal anecdote, I was in Kirksville in 2015 with some colleagues that I was at school that I was working at, and one of the things that they did for us in the lab was they brought out the ultrasound units that they used to help improve palpatory accuracy for the students at ATSU. So the medical students will do ultrasound guided palpation exercises to properly identify. One of the people there had volunteered to be the be a model, right, or be on the table. So they had multiple ultrasound units out. People were using them to try to get an understanding of them and how they may be beneficial. And this person is not a large person. In no way is their body composition something that, you know, you would take into question. But it was quite surprising, because this person's L5, this person's lumbar column, was obscured by an odd amount of adipose tissue, an odd amount of fat. And it was really interesting because you wouldn't expect that from this person. This person was not a large individual, but there was a lot of subcutaneous fat that was obscuring the ability to even find L5 with the ultrasound machine, to the point where the ultrasound tech who was helping us out, or was helping the group out, essentially said, wow, this is kind of strange, we should put this up on a big screen. And if you've ever seen the OMM teaching hall or teaching room at ATSU, it's very, very large. They have a very large screen, they have a stage, and they have a lot of video equipment, so they're able to beam that up. It was really interesting because this individual has a tendency to joke a lot, and was kind of going back and forth with people, and people were essentially taking shots at him because of the odd amount of adipose tissue that was covering his lumbar column. But that's just to say that I have some personal experience with somebody that you wouldn't expect having a large amount of adipose tissue actually having it. So Again, this is the first step in trying to identify and share and show some of the reasons why I say the things that I do, right? So this more points to palpation, that accuracy is not the number one issue. Motion is. We want to identify motion more than we want to identify absolute specific structures. Some are easier to find than others. And I'm going to go through a few over time here in a similar fashion and try to make sure that we can share and show. But also moving from the known to the unknown. If you do have a reason to try to find something, find it from easier things to identify. Find it by being in the general area and use movement to expose it. Those are some strategies that seem to be quite useful. So hopefully this was helpful, and we will do more of this over time.